Alopecia, commonly known as hair loss, is a medical condition characterized by the partial or complete absence of hair from areas of the body where it normally grows. This condition can affect both men and women of all ages, leading to various physical and emotional challenges. Alopecia presents with gradual thinning of hair, particularly on the scalp, circular or patchy bald spots, and sudden loss of hair in specific areas. Full body hair loss, though rare, but can occur in some cases. Family history plays a significant role in many cases. Imbalances due to pregnancy, childbirth, menopause, or thyroid problems. Medical conditions such as autoimmune diseases like alopecia areata, scalp infections, or underlying medical treatments like chemotherapy. Emotional or physical stress can trigger temporary hair loss. Lack of essential nutrients like iron, protein, or vitamins. Certain drugs can cause hair loss as a side effect. The diagnosis of alopecia begins with medical history that gives an understanding of any underlying medical conditions, family history, and recent life events that can provide valuable insights. A healthcare provider may examine the scalp and hair pattern to determine the extent and type of hair loss. Pull test is conducted to evaluate the ease with which hair is dislodged, indicating conditions like telogen effluvium. Trichoscopy, where a device called trichoscope is used to magnify and analyze hair and scalp, aiding in the diagnosis of conditions like alopecia areata and assessing hair shaft abnormalities. Dermoscopy, that involves the use of a handheld magnification device with light to closely examine the scalp, aiding in diagnosing various types of alopecia. Blood tests to check for hormonal imbalances, nutritional deficiencies, or autoimmune markers can also be done. The treatment of alopecia varies based on the type and underlying cause of the condition. Minoxidil is an over-the-counter topical treatment stimulating hair growth by increasing blood flow to the scalp. It is available as foam or liquid. Finasteride is a prescription medication for men with androgenetic alopecia. It inhibits dihydrotestosterone hormone to combat hair loss. Topical or injectable corticosteroids reduces inflammation and immune response in alopecia areata. It is administered by dermatologists. For alopecia areata, topical anthralin cream is used to induce hair regrowth. It is prescribed by dermatologists due to potential skin irritation. Application of topical immunotherapy to induce an allergic reaction, stimulating hair regrowth. Laser combs or helmets emitting low-level lasers is used to stimulate hair follicles and promote growth. They are available for home or clinical use. Blood-derived growth factors are also used to stimulate hair growth. Hair transplant surgery is another treatment option that involves moving hair follicles from a donor site to balding areas. It is particularly effective for androgenetic alopecia. Non-medical solutions provide immediate cosmetic solutions for hair loss, include offering wigs, hairpieces, and extensions. Counseling and support groups provides emotional support and coping strategies for the challenges of living with hair loss. Alopecia might have psychological impact like low self-esteem, depression, and anxiety. Social implications of alopecia include difficulty in social interactions and personal relationships. Exposed scalp is vulnerable to UV radiation, leading to sunburn and skin damage. Stress or anxiety can exacerbate hair loss. Various strategies to prevent alopecia and promote stronger and healthier hair include adopting balanced diet, regular exercise, and adequate sleep. Stress management, including relaxation techniques, counseling, or support groups. Gentle hair care practices, avoiding tight hairstyles or excessive heat. Keeping the scalp clean and moisturized. And prompt treatment of underlying conditions or hormonal imbalances. If you found this video helpful, don't forget to like, share, and subscribe for more informative content.